All right. Hello, everyone. So today we're going to be talking about something people ask me all the time, which is, do I have to take blood pressure medication forever? Like I mentioned, over half of the adult population in the US has high blood pressure. Unfortunately, not all of them know it, but high blood pressure is so common. And a lot of people are on blood pressure medication, and many of them may have side effects or just would prefer not to be on medication. And so they're trying to figure out how to get off of it. So if that's you, keep listening. People want to know, is there a way to safely lower or even stop the medication? And the truth is, the answer is not the same for everyone. It really depends. And I will be talking about some of the things you want to consider when you're making this decision. So I'm Dr. Lola Ashaye. I'm a board-certified family medicine and lifestyle medicine doctor and owner of InTouch Primary Care Clinic in Sugarland, Texas. And you are listening to Connecting the Dots with Dr. Ashaye, which is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. Okay, so high blood pressure is a very, very common condition, and some people have decided they want to use supplements to lower their blood pressure. But one of the issues is supplements are not all created equal. So if you're one of those people that want to learn more about that, we do have something for you. You can access our helpful guide on 5 key supplements that lower blood pressure and how to choose them. But remember, always talk to your doctor, especially if you are already on medications before you start any supplements. Okay, so let's get into today's topic. So high blood pressure. First thing to understand, like I said earlier, it's not one size fits all. We need to first figure out what's causing your blood pressure to be high before we talk about reducing dependence on medication. So there are some common causes, and we'll talk about the ones that are common and how we can fix them. So some people are very sodium sensitive, which means that even with a little bit of extra sodium in their diet, their blood pressure shoots up and they retain fluid, okay, because they retain fluid. So for those people, if they are very, very vigilant in cutting their sodium below 1,500 milligrams per day, which is about a 3/4 teaspoon of salt, they can lower their blood pressure 5 to 6 points, right? And so that's almost like how much medications lower blood pressure. So the problem is a lot of sodium hides, right? So when I talk to people about sodium, they're, oh no, I never add salt to my food and things like that. But if you're eating processed foods, most processed foods have sodium. So reading the label is so crucial, so important when you're choosing what to eat because sodium can hide. So trying to really, really lower sodium intake will be helpful and it can be very, very helpful in some people. The other thing that affects blood pressure is body weight. So many people, there are certain people that lowering their weight can make a huge difference in their blood pressure. For some people, if they lower their weight by 5 to 10% of their body weight, their blood pressure drops 5 to 10 points. A big part is not just overall weight, but also the belly fat, right? Which is one that a lot of people focus on. So if you can focus on lowering the belly fat, that can really also help to lower the blood pressure in general. So this is not just for people that, because people think of being overweight only based on their overall weight, but it's possible to have a normal BMI and have a larger than normal waist, which can still put you at risk for metabolic conditions. So just being careful with that belly fat, it does make a difference. Okay, the other thing that can truly affect how your blood pressure and whether or not we can, lower your dependence on medication is sleep. So if people are not sleeping well, it would definitely affect the blood pressure because your cortisol level is high, you're under stress, your body doesn't understand that it's just because you didn't sleep, it thinks something is really happening, and so your blood pressure stays high. conditions like sleep apnea can also really affect the blood pressure because you're not really sleeping when you have sleep apnea. So if you snore and you wake up feeling tired, you're taking naps all the time, you're falling asleep really easily, it's really important to check to see if you have sleep apnea, because treating sleep apnea can really help lower the blood pressure. Okay. So before we go on, if this is resonating with you, please go ahead and hit that subscribe button. That way you will not miss any of the information that we're putting out there. And this is real-world evidence-based advice, so you can live your healthiest life. Also, go ahead and share, like, so others can learn about this information. Okay, so sometimes actually the cause of high blood pressure in some people is another medication. So there are some medications that can actually raise blood pressure. And some of them are ones that you get over the counter, like ibuprofen, Advil, Aleve, which are called NSAIDs. And some people are not aware, maybe they're taking the NSAIDs for other reasons, and meanwhile, that is raising their blood pressure. Also, some antidepressants can raise blood pressure. The more obvious ones are decongestants, which are cold medications, which can hide in many combination cold medications, and people take them for colds and coughs and things like that, and it can raise blood pressure. Also, birth control pills can raise blood pressure as well. So I had a patient whose blood pressure was well controlled, and then he went to see a specialist, and they added a new medication and for another issue. And then his blood pressure shot up, and he was following up with everybody. His legs were swollen until he came to us, and we looked through all his information because he had been going from specialist to specialist trying to figure out what was going on. But just being able to sit down, not rushing, and take our time and go through everything, found out that it was a medication that he had been started on a few months ago. And by stopping the medication, his blood pressure returned to normal. So different medications can also affect blood pressure, and it's important that that's reviewed when you are looking to lower your dependence on medication. So can you safely reduce blood pressure medication? Maybe. It depends on the root cause. You may be able to reduce, you may be able to stop your blood pressure medication, but never try to do this on your own. You always want to work with your doctor, someone that would slowly adjust your medication so it doesn't drop too low, and someone that would be monitoring it so it doesn't stay high consistently and cause major problems. So there are also supplements that can be used to lower your blood pressure. And if you want to learn more about that, you can access our helpful guide on 5 key supplements and learn how to choose high quality options so you get optimal results. But same with supplements, you always want to talk to your doctor first before adding any supplements for any reason, including for lowering your blood pressure. Okay, so can you get off blood pressure medication? Like I said, it depends. Work with your doctor, find the cause, try to monitor, track your lifestyle to see if there are any triggers that you can identify on your own. And in many people, it is possible. It's just a matter of working with someone and looking through like being careful about the lifestyle decisions that you make. All right, so that's it, all we have for today. In the next episode, we're going to cover natural ways to lower your blood pressure. But don't forget to hit the like, subscribe, and share button so that those that might benefit from it might find out about this information, and it could really make a difference for them. I hope that helps.